Hello again. How are you doing? Good. So it's been a couple of hours since I've seen you on the ward and we had our little chat and a check over. Yeah. So now's the time for your surgery. Are you feeling relaxed? As much as you can be, of course. Yeah. Okay. Well, you know that we're all here to take excellent care of you, and we have a fabulous team, so I don't want you to worry about anything, okay? Everything is going to be fine today for you. I just need to double check through the forms that we filled in and just something that my nurse has checked with you before you came down. So let's just check. Just tell me your name. Okay, that's fine. And just double checking your allergies. You don't have any known allergies to latex or any medications. Okay. All right. And you did say to me earlier that you were a little bit anxious about having gas. Okay. Well, you aren't going to smell any gas today. What's going to happen is, when we've got you set up and all the monitors are running, I'm going to give you something to make you feel a little bit relaxed, and then I'll administer something which will make you go into a nice sleep for a short time. You will have a mask on with oxygen, and it is just oxygen, which I will give you before I administer any medications today. But I assure you, you won't smell anything. It is just oxygen. We need to pre-oxygenate your system before we give you the anaesthesia. Okay? So then what's going to happen is, when you've had your medication and you're nice asleep, we'll take you through to theatre. We're going to access the area of your brain that needs to be operated on, okay? And then when we're all happy, we're at the point where we need you to start communicating with us. We're going to bring you out of the anaesthesia to awareness, and then you can follow commands whilst the surgery is being carried out. Okay, we need to monitor how you are functioning during the surgery to make sure that parts of the brain that we don't need to be touching aren't being touched. Okay, so you'll just be asked to do some simple things to identify some images, perhaps say a few words and make some movements maybe with your hands. Okay, very simple things, but you will be able to do this and you won't be feeling any pain because the actual area will be anaesthetised. Okay, and then when that part of the surgery is complete, we will then give you a little bit more medicine just to make you go back into a sleep while we close up the area, and then you'll be taken to recovery. Okay, so do you have any further questions? Okay, just bear with me. I'll get the nurse to take your notes away. Just take those for me. That's great, thank you. And I'm going to begin by getting you ready for your anaesthesia today. All right. Okay. So first thing, I just need to put some ECG leads, a couple on your chest, okay, just so we can monitor your heart rhythm throughout the surgery. Okay, so nice and sticky. All right there, so let's just do that. There we go, there's one there. Let's get another. And put that one there. You okay? Good. There we go. And I just need to pop one onto your ankle. Alright, there we go. They feel all right for you? Yes, we'll check those. All right. Okay, that's good. I'm going to put this onto your finger. Okay, this is just going to monitor your pulse. Okay. All right, so let's just pop that on there for you. There we go. That's comfy. Good. Okay. And I just need to connect up some of the leads onto your chest, which go onto the ECG machine. Okay, so there's that one. Okay, just make sure that that's working okay. And this side. Okay, and just one more, which I'm going to pop down here. Okay, lovely. So let's just look at the machine there. Okay, that's all running good. So we've got your pulse and we've got your heart rhythm. Okay. Your blood pressure will be monitored as well. I'm just going to pop this tourniquet on. Okay, around your arm. Because I just need to pop a cannula in so we can administer your medications straight into the cannula. Okay, so that's around your arm nicely there. Okay, let's just pop that there. Will feel a little tight, I'm afraid. Okay, alrighty. So this is the cannula. I just need to place that in the back of your hand. So I'm just going to get a wipe and wipe the area round. Okay. Right, there we go. That's perfect. Okay. Right. Just ask you to keep extremely still while I insert the cannula into the back of your hand. You will feel a little sharp scratch as I do this, okay? So, there we go. That's the cannula. You wanted to see it, didn't you? So that's the cannula. Alright, just take some nice deep breaths. Little sharp scratches. I just pop this in, okay? There we go. Okay, just release that. There. That's all done. Okay. So I just need to pop a dressing over the cannula. My beads over the cannula. Okay. Right. Because we need it to stay in place. Okay. That's great. Just make sure that that's nice and stuck on there. You doing all right? That's perfect. Okay, so that's all in place now. All right, so let's just take a look. Take a look at the monitor there. Okay. I'm just going to let you rest just for a couple of seconds while I just prepare the next little part. So just take some nice deep breaths. Okay, so in and out, and in and out. Okay. All right, you're doing fine. to make sure that when you wake up, you're going to be feeling as comfortable as you were when you went down, all being well. You're not going to be feeling any pain, okay? I will give you an anti-nausea medication because unfortunately some of the side effects of some of the medications can make you feel a little bit nauseous, as can the surgery itself. When you are awake, if you still feel nauseous, then just tell the nurse and we can administer some more. Yeah? Okay. Right then. I'm quite happy with that now. So stay relaxed and I'll just be getting you to breathe a little bit of oxygen. Alright. Okay. So here's the mask. It's just a very soft mask and it doesn't smell of rubber like the old masks used to, because I know you'd mentioned that earlier that you didn't like that smell. You'd remember it from when you were a child. I think we all remember that from when we were small. Okay, so make sure we're all good there. Okay, so just relax. I'm going to place this gently over your nose and mouth. I just want you to take just some deep breaths for a short time just to get some oxygen, and I promise you it is just oxygen. Okay, all right, so you just relax there. Okay, there we go. There we go. And breathe nicely. That's super. You're doing great. Everything's looking fine with your heart rhythm, your blood pressure and pulse. This is what we like to see. Okay. See, I told you it wasn't smelly gas. It's just oxygen. Just keep breathing for me there. Okay. There we go. Okay. In and out. Okay. Just pop your left hand up to tell me that you're okay. That's super. Alright. Okay. That's lovely. Okay, so I'm going to remove the mask now. Okay. There we go. And I'm just going to give you a little bit of medication in your cannula. Now, this will make you feel a little bit light and floaty. Okay, it will work pretty quickly. But this isn't the medication that's going to make you go to sleep. Okay, so let me just get your hand there. Okay, and just popping this into the cannula. There we go. So have you got any holidays booked this year? Oh, nice. Okay. It's a lovely place. And it'll be hot then, won't it? Yeah. There we go. That's all in there. So, you're taking the family? You have a lovely family. I've met them. They're all waiting back at the ward for you. Yeah. Okay, let's just check all your needs are good there. Okay. Just check. Yeah. That's fabulous. Okie dokie. Okay. So you're starting to feel a little bit floaty. A bit giggly. Okay, we don't mind giggly. Alright, so yeah, you might feel a little bit fuzzy. Good, okay. So, I think we're all ready for you now in theatre. So, you just relax okay? And I'm going to give you some of that lovely sleepy medicine. Right. And I shall slowly pop this into the cannula. Now you might feel a bit of a stinging or warm sensation running up your arm through your body as I do this, okay? And in no time at all you're going to feel so sleepy and you'll be out and dreaming, and then we'll bring you back to awareness shortly. Okay, so I'll see you again soon and have some really pleasant dreams. Okie dokie. Think about that holiday. Yeah? Think about all that sunshine and all that lovely blue sky and warm sea. Hello there. You're back with us? Okay. So you recognise me. I'm Surgeon Sarah. We spoke earlier. That's good. Okay. You're probably going to feel a little bit sleepy for a few seconds. Okay. Alright. So I just want to do a couple of little checks. Okay. Can you just squeeze my hand for me with your left hand? Okay. Can you tell me, can you see clearly? That's good. Okay. I just want you to identify a few images for me. I'll be asking you to do this throughout the surgery as well. Okay, can you tell me what you see there? Okay, that's fine. And what you see there? Yeah, okay. And what you see there? Okay. And what number do you see there? All right. That's perfect. Okay. So what I want to do first, before we proceed, you are anaesthetised in the area that I'm going to be working in on this left side, okay? I just need you to tell me if you feel any pain whatsoever, okay? When I ask you to, all right then, you just relax there, okay? There. No. Oh, there. There. No. There. There. No. Okay. There. Okay. So myself and my team are going to be taking good care of you today, and we'll be working on fixing your problem, okay, to help with these seizures that you've been getting, okay? And I will be asking you questions throughout, or asking you to do very simple things, okay, like raise your hand or identify those images, okay? All right, so are you feeling back to full awareness now? Good, good. Okay, so keep very still. You have my nurse to the side of you there, and she is going to be keeping a close eye on you too, okay? Plus all the surgery and anaesthetics teams are keeping a close watch on you, okay? Everything's looking fine on the monitors at the moment, so that's good. Okay, if at any point you feel anything uncomfortable, if you could say so, or just raise your hand. Okay, so let me just shine this light into your eye very briefly. Okay, alright, can you just look up for me? Alright, okay, and can you just look down for me? Alright, and side to side. Okay. So you're welcome to close your eyes at this point and just relax. Okay, so let's just begin here. Okay. Could you just pass me some irrigation? Okay, thanks. Just going to irrigate the area. There we go. Okay. And some more irrigation, please. Thank you. Could you just raise your left hand for me? Okay, and your right hand. Super, okay. Okay. Can you just tell me your name? Okay. Okay, what's my name? Okay. Super. Super. Right, and let's just move a little bit further around. Okay, can you hear a noise? Which side can you hear it? Okay, that's good. That's good. Okay, I just need the other tool. Right. Okay. You're not feeling any discomfort? No? Okay. So where are you going on holiday this year? Okay. Can you tell me what you see? Can you tell me what you see? What colour can you see? And what shape? Okay. And what's that word there? Okay, super. Okay. Can you count backwards for me from 10 to 1? That's perfect. Okay. Just gonna put some more irrigation in there. Okay, I'm just going to shine a light into your eyes. Okay, very briefly. Alright, okay. Pupillary reactions are still fine. Okay, can you just look up for me? Okay, and down. Okay, and side to side. That's perfect. You are doing fabulous. Okay. And you're not feeling any discomfort? No, that's good. Okay. Alrighty. Right, I just need to get the other tool that I'm needing. Okay. Keep breathing nice and calmly for me. Okay. And you're still feeling no discomfort, that's good. Okay, could you just raise your left hand for me? And your right. Okay, that's great. Okay. Could you just pass me a swab, please, nurse? Thank you. Have such a great team here. Okay. Alright. Okay. Can you just tell me if you can feel me pressing on these areas on your body? Can you feel me pressing on your cheeks? Okay, can you feel me pressing on your forehead? Can you feel me pressing on your jaw? Okay, close your eyes, and where am I pressing now? That's good. Okay, and where am I pressing now? That's good. Your chest. Okay, and so what am I doing? I'm holding your left hand. That's fine. Okay. Irrigate a little more. Right. Just one little bit to do. Nice and still for me, thank you. Alright. Just around with this gauze. Just have a little look now. Okay. I'm just going to let you lie still for a little while, and then I'll be back to ask you a couple of more questions. Okay. Okay. Great. So, can you tell me what's my name? All right. Okay. Can you see clearly? Right. Can you just raise your left hand? Okay, and can you raise your right? Okay. Right. Tell me what you see there. shape do you see? Okay, and what colour is it? What day of the week? Okay, and what day follows that? Okay, what do you see there? And what do you see there? Okay, and what drink do we get from this animal? Okay, you're doing really well. And what's this here? Okay. And what's that? It's a number 8. So what number comes before 8? Okay, and what is 8 plus 2? Okay, that's perfect. Thank you. Right, so that's fine. That's fine. I'm just going to have another look there. Just irrigate that area. Okay, we're looking good. I'm just going to go in now with a light very, very closely there. Okay, alright. We're looking good. Could you just close your eyes for me? Tell me what side you hear the sound on. Okay, and again. And again. Okay, and again. Okay, keep your eyes closed for me. Can you tell me which part of your body I'm touching? Okay. And which hand am I touching? Okay. Can you open your eyes for me? Can you open and close your mouth? Perfect. Okay, can you just look up and down and left to right? Okay, that's perfect. Well, you'll be pleased to know that everything seems fine. The part of your brain which had the issue looks to have been successfully treated there. So what we're going to do now is we need to put you back to sleep just so we can close up the area, and then we'll take you back to recovery and we'll see you a little bit later when you've woken up again. Alright, so what I'd like you to do, just like before, just take some nice deep breaths, okay? Wow. Give you some oxygen. It's just oxygen. Okay, there we go. And we're going to put some of that nice sleepy medicine into your cannula, and you're going to drift back off to sleep, and we'll all see you again later. Okay, so in and out with the breath while you drift off there. Okay, sweet dreams.